Okay. Okay, we go to another group, which is we talk about hip adductor, right? Hip adductor. Okay, hip adductor. All right. So again, this hip adductor basically we can call as a groin muscle actually, groin muscles, and also this become your middle compartments of the thigh. Okay, middle compartments of the thigh, and okay, generally when we talk about hip adductor class, right? Again, what you should know about hip abductor basically, these muscles, this is your acetabulum, right? This is your femur anteriorly, all right? Your lesser trochanter, all right? Simple diagram class over here. This is your superior ramus of pubis, right? This is body of pubis, all right? This is inferior ramus of pubis class, and very thick area over here class. This is what we call as a ischial tuberosity, all right? Okay. Okay, I just select a few structures from your pelvic, right? Because uh, to show you the exactly origin for this hip abductor actually. Right. Right. So refer to this structure actually, right, class. Now I try to make it smaller so that you understood which structure that I pointed out. All right. This diagram, you should familiar with this diagram, right? Okay. This diagram. Okay. So usually when we talk about the hip adductor class, this muscle basically. Okay, don't forget your femur class over here with your femur. All right. Usually, when we talk about hip adductor, this muscle basically originate from this region actually, medial your pelvic girdles actually. Okay, medial pelvic girdle, meaning that this muscle originate from where? I think you can label everything. So this is your superior ramus of pubis, right? I think you can label everything, right? This is body of pubis. Okay, body of pubis, and again I assume every bony structures of the femur and so your pelvic you should very familiar, all right? And here you call as a, yes class, inferior ramus of pubis, all right? And absolutely this is your ramus of ischium, and this ramus of ischium posteriorly become thickened, and this region we call as a, yes class, we call as a ischial tuberosity. Right. So now, so when we talk about hip abductor, all these region you should very familiar because all these muscle basically originate from this C-shaped area, which is coming from your pubic and also coming from your part of ischium. Okay, and this muscle, in order to produce hip abduction class, these muscles basically generally we can say that these muscles, number one, cross your hip joints anteriorly. Number two, this muscle cross your hip joint in transverse axis actually, in transverse axis, which is from the middle to lateral. Okay, so this muscle somewhere around here, for example, I made a line so that you can understand this is the line of pull, how that muscle contract and pull your femur. All right, this way, this way, guys, this way. All right, all right, this is how the arrangement for the hip adductor. Right, number one, you should remember these muscles cross hip joint dekat bahagian mana? anterior. That's number one. The rule, how your hip abductor can act as a hip adductions. Number two, this muscle basically cross your hip joint usually in transverse axis, okay, in transverse axis, okay, from medial to lateral. And again, you can imagine class when this muscle contract, this muscle akan pull your femur towards midline, right? So that you can produce pergerakan apa? Hip adduction class. Alright, okay. So this muscle for hip adductor, you should remember class for hip adductor, absolutely hip adductor. Alright, you have five hip adductor actually. The first one, hip adductor, known as a pectineus. Right? Pectineus. Number two, we have adductor brevis. Number three, we have adductor longus. Brevis means short, longus means long. Number four, we have gracilis. And the last one, the biggest one, we have adductor magnus. Okay, adductor magnus. Clear class of far?
Clear.
All right. Now, so this arrangement basically class, how I make this kind of arrangement, right? Usually I make this arrangement based on attachment side, right? So I assume class, can you see this C shape? This is from the superior to inferior class. From superior to this point, I make this arrangement based on attachment side, meaning that you need to imagine that these muscles attach from here until this region. All right. You can imagine this now. For example, this is the pectineus, this is adductor brevis, this is adductor longus, this is gracilis, and adductor magnus. So this is how I make arrangement so that you can imagine, you can remember the exactly origin for each muscle class. That's why before you remember this original class, you should remember about every structures here: superiormus, body, inferiormus, ramus of ischem, and also ischial tuberosity, because all these muscles are attached somewhere around here, class. Okay, somewhere around here. Please listen carefully, class. The first muscle basically your pectineus. I make number one over here. This number one. Okay, so this is superior of pubis. Okay, superior ramus of pubis. So superior ramus of pubis, this is become origin for which muscle class? This is origin for your pectineus muscles. Okay, it become origin for the pectineus muscle class. Right, I think I need to show you this diagram first, this picture, so that you know the exactly position your hip adductor muscle class over here. See, this hip adductor. So I need to remove all the flexor muscle first. All right, your rectus femoris, your vastus medialis, vastus lateralis class, right? So now, all right, this is the middle compartment muscle, which is this what we call as an adductor group, adductor muscle over here class. This is adductor muscle, see? Adductor muscle over here. Okay, so the first one we can see over here, this is your pectineus, right? So this is the pectineus, and then followed by this adductor longus. Just deep inside the longus, you have adductor brevis over here. Okay, superficial you have adductor longus. All right, inside you have adductor brevis over here. And then if I remove this adductor brevis, what you can see here, the most medial you have muscles known as a gracilis over here class. This is the gracilis. And the largest one, this will be your adductor magnus. Okay, this is what we call as a adductor magnus muscle class, right? So, okay, from first muscle, which is your pectineus. So this is the pectineus. Pectineus actually coming from where? It's coming from this region. That's why before you want to memorize all this muscle, okay, you should remember about this structure first. This structure over here, this structure. Okay. meaning that this is superior ramus of pubis, this is body of pubis, this is inferior ramus of pubis, this is ramus of ischium, and the most inferior, this is your ischial tuberosity. So meaning that the first muscle will be your pectineus. Pectineus basically origin from where? It origin from your superior ramus of pubis. Or some book says it origin from your pectineal lines of the pubis. Somehow it origin from where? Superior of pubis. And this muscle is moving mid laterally and attached into your, yes class, it attached into your femur. Which surface of the femur? Posterior surface at the back actually. See? I think I already explained to you this structure class. Am I right, class? Can you remember, class, this structure class? This is your intertrochanteric crest, right? Laterally, you have gluteal tuberosity, and medially, you have this line. Apa nama line ni, class, actually? Which is extend downward as a linea aspera. This line known as a, yes, class, this line? Extend downward from, very good, pectineal line. That's what we call as a pectineal line because of it become incision for the pectineus muscle class. It become incision for pectineus. So again, origin is very, very clear. Superior ramus of pubis, incision to the pectineal lines of the femur. Okay, that's number one. Right. Number two. Right. Number two, we have adductor longus. This is adductor longus. Okay. So adductor longus. Okay. So this is adductor longus. Okay. It origin from where? So this is again superior of pubis, right? So this is the superior of pubis because this is the body of pubis. So this adductor longus also originate from the superior of pubis, but close to the body of the pubis. Okay. So here, origin for the pectineus muscle, which is confirmed, you should know that this is superior of pubis. But in terms of adductor longus, the origin basically superior ramus of pubis, but close to the body of the pubis, right? So this muscle basically insert into which area? Again, it attach into your shaft of the femur. Okay, shaft of the femur, right? But it's not anterior surface, but it attached into the posterior surface. And as you know, posterior surface shaft of the femur, this is what we call as a linea aspera. Okay, linea aspera. Because of when we talk about shaft of the femur, right? Linea aspera, I explained many times to you that this vertical ridge basically become attachment site for many muscles, and maybe it become origin or maybe it become insertion for certain muscle class. In this case, your adductor longus basically insert into your linea aspera. Which part of linea aspera? More specific, not the whole linea aspera actually, right? The whole thing is linea aspera, right? But not every linea aspera. More specific, we can say this adductor longus attached into the middle one third, middle 1/3, middle 1/3 of the linea aspera. Origin, superior ramus of pubis, incision, middle 1/3, linea aspera. Right? Right. So the next one is class, right? Just deep into your adductor longus, and this somehow this muscle is a bit short. That's what we call as a adductor brevis. So this is the adductor brevis actually. Okay, it's a deep muscle to your adductor longus, and it's a bit short, right? All right. And this muscles basically origin from where? Again, that's why I arrange this muscle based on attachment site, based on origin. The first one, pectineus. Number two, you have your adductor longus. Number three, now a bit lower, where this muscle originate from where? From your body of pubis. So this is the body of pubis actually, right? So this muscle is quite shorter, originate from the body of pubis and insert into same thing, insert into your linea aspera. But the thing is, okay, if this middle 1/3 become insertion for the adductor longus, meaning that this is the proximal 1/3, proximal 1/3, 1/3, proximal 1/3 of linea aspera become insertion for where? Insertion for which muscle? This is your adductor brevis. Okay, plus adductor brevis. Right, next. Right, so this is your pectineus, this is your adductor longus, and this is your adductor brevis class, right? Now, the most medial muscles among all these adductor muscles, basically, this is your gracilis, right? So this is your gracilis actually. Your gracilis actually originate from where? It originate from your inferior ramus of pubis. Again, I repeat last. Superior ramus of pubis here, this is your pectineus. Superior ramus of pubis close to the body, this adductor longus. Body of pubis, that one is adductor brevis. When we talk about inferior ramus of pubis, this is become origin for your gracilis. Inferior ramus of pubis become origin for gracilis. And this gracilis basically sitting the most medial muscle of the adductor compartment. And this muscle, again, this is biarticular muscle. And this muscle insert into your, I think you know the incision class, right? Because this gracilis share common incision with your, which muscle class? This gracilis share common incision with another muscles. And that muscle will be your gracilis share common insertion with another two muscles, and that two muscle will be
semitendinosus,
and also
sartorius,
sartorius. Okay, so gracilis akan insert dekat which area? Inferior surface medial condyle of the tibia. Okay, okay. Same spot with sartorius, same spot with semitendinosus class. Right, right. So now complete four muscle class. Okay, complete four muscles. Gracilis, adductor brevis, adductor longus, and the most superior, basically your pectineus class. So far, any questions so far, class? Anything class so far? So this is your gracilis, right? Okay, anything class so far? Before we go to the last part, class, which is the biggest part of the adductor group, which is we call as a adductor magnus. So far, class, ada soalan? Anything?
Can you repeat the insertion for pectinis again?
Pectineus. Incision for
Pectinis, yeah.
incision for pectineus basically pectineal line, all right? Pectineal line. Can all right. That's why we have pectineus muscle. What is a pectineal line? How you define pectineal line actually, class? Right. Again, I'll show you something. Listen carefully. Right. This is something like prominent marking that you should know. When you view your femur posteriorly, you should know what is the prominent marking. Okay, where is the landmark actually? First, you should remember when you want to identify the gluteal tuberosity and the pectineal line. First you need to identify the greater trochanter first. This is the greater trochanter. Just below to greater trochanter, just below to greater trochanter, can you see? This is roughened surface on the lateral side. Below the greater trochanter, this roughened surface, this is what we call as a gluteal tuberosity. Clear, class? And this gluteal tuberosity basically extend downward, enter your shaft as a linea aspera. See? So this is your linea aspera actually. Okay. Whereas on the middle side, again, okay, the first structure that you need to trace is your lesser trochanter over here. From lesser trochanter, there's one prominent line over here moving downward. See this line moving downward and continue its journey until reach your shaft. When enter your shaft, now these structures you call as a linea aspera. Because as you know, this linea aspera consists of two lips, right? It consists medial lip and also it consists lateral lip. Now, by the way, this line, which is extend from the lesser trochanter of the femur moving downward towards the linea aspera, this line, see this line, please, this line you can see, known as a pectineal line. Okay, pectineal line. Why we give name as a pectineal line? Because of pectineus muscle attached into this line actually, right? That's what we call as a pectineus line. Clear, class? Clear?
Okay.
Clear, right? Okay, good. All right. Okay, now we talk about the last the last muscle for the adductor group, which is the biggest one, which is we call it as an adductor magnus, right? Adductor means this muscle produces adduction. Magnus means this muscle is basically super big, very, very big actually, class. This adductor magnus actually, right? If you observe this muscle, class, right? Basically, these muscles, okay, these muscles consist of two parts actually. This muscle consists of two parts. All right. If you observe this muscle, right, you can imagine, right, one muscle sitting anteriorly, more anteriorly, and one muscle sitting posteriorly, right? The muscle which is sitting anteriorly, right, is very wide, flattened in term of shape, and attached into your linea aspera, one shape over here, which is anteriorly, right? One fiber over here. Because of this muscle are so big, right, and it has two part, anterior part and posterior part, and also not only it has a two parts actually, in term of nerve innervation, basically this muscle receive nerve innervation from two different nerve actually. Receive nerve innervation from two different nerve actually. One's anterior, one at the posterior. Two part basically receive innervation from two different nerve actually, class. Right? So the first one that you should know is, class, the first part. Sorry, I think I explained the posterior part first. The posterior part, class, over here, class. This muscle actually coming from where? It coming from your from ramus of ischium, and also coming from where? From ischial tuberosity. Okay, okay, ischial tuberosity. Okay, can you see, class? Over here, class. All right, all right, over here. Okay, so this muscle coming from ischial tuberosity. Okay, ischial tuberosity, and this muscle moving downward and attached into which region, class? Yes, class. I think you know this structure, class, over here. Yes, just above your medial condyle of the femur. Yes, class. You have one projection tubercle over here. Yes, class. Above medial condyle of the femur. Yes, class. Can you name it, class? This tubercle above medial condyle of the femur. Yes, this tubercle over here. This is the medial condyle and this is the lateral condyle, right? Above medial condyle. This is the medial condyle and this is the middle epicondyle above middle epicondyle. So this tubercle we call as a, yes, class. Very good. Adductor tubercle. Now you should remember that this adductor tubercle basically become attachment site for this muscle actually. Yes, for this fiber, which is this fiber coming from where? Coming from ischial tuberosity. Okay, and attached into this adductor tubercle. So this is the posterior part, posterior fiber. Okay, posterior fiber of the adductor magnus. Okay, so this posterior fiber of adductor magnus, right? Since it attached from the ischial tuberosity, which is your ischium, and attached into the superior surface to the mini-condyle, which is referred to as the tubercle. That's why this fiber we call as a ischiocondylar fiber. Ischiocondylar fiber. Don't worry, after this I will draw for you. Okay, for the time being, you should know this muscle we call as a ischiocondylar fiber. But by the way, the whole thing we call as an adductor magnus, but somehow when this muscle attach, because this fiber basically at the posterior side and it attached in different structure. It extends from the ischial tuberosity and attach into the adductor tubercle. That's why this part, okay, based on structure, we call as a, based on origin and incision, we call as a ischiocondylar part of the adductor magnus. That's the first one. The most anterior class, right? The most anterior, basically this muscle basically sitting anterior. Okay, sitting anterior. Where this muscle basically attached dekat mana? Dia attached dekat bahagian your inferior ramus of pubis, and also it attached also dekat bahagian mana? Ramus of ischium. Okay, inferior ramus of pubis and also ramus of ischium. That's why when this muscle more anterior, right, and also it attached into your ramus, inferior ramus of pubis and also ramus of ischium, and this muscle basically insert into your, yes, it insert into most of the linea aspera. Okay, we can say more specific, we can say distal two-third. distal two-third linea aspera, right? You can imagine the whole thing is linea aspera. Okay, this is proximal one-third, and this is distal two-third. So it attached into your distal two-third linea aspera. It coming from where? It coming from the inferior ramus of pubis and also ramus of ischium. That's why this fiber we call as a pubofemoral fiber. Pubofemoral fiber. Okay, which is anterior fiber of the adductor magnus. Okay, so anteriorly we have adductor magnus pubofemoral fiber, which is coming from inferior ramus of pubis and also ramus of ischium, and attached into the distal two-third, dua per tiga, distal two-third linea aspera, and the most posterior fiber we call as a ischiocondylar fiber. With this muscle coming from where? Ischial tuberosity and insert into the adductor tubercle class. Adductor tubercle. Okay. So now, but when we talk about what is the general origin and incision for this adductor magnus, you can say that adductor magnus classical origin from where? Inferior ramus of pubis, ramus of ischium, and also ischial tuberosity. And this muscle insert into linea aspera and also insert into your class, insert into adductor tubercle class. Yes, class. Ada soalan saya ni? Yes, class. Anything?
Okay.
Clear semua? Okay, class clear? Right now. Um, okay, my diagram, simple diagram over here, class. Now, I think by this diagram, right, you dah boleh explain everything, right, class? You dah boleh explain everything, the origin insertion class over here. Maybe I can enlarge this diagram. Okay, I can enlarge this diagram, and also you can draw on your own way, all right, to how to want you want to simplify all this diagram, all right. Absolutely, this is sacrum, right? This is sacrum, and this is your iliac crest, ASIS class, right? Okay, this is the superior ramus of pubis. This is your body of pubis, right? All right. Okay. So you are very, very familiar dengan this diagram actually, class. Okay. So superior of pubis, body of pubis, and this is the inferior of pubis, and this is the ramus of ischium, and posteriorly you have ischial tuberosity. All right. This is your shaft of your femur, class. Shaft of your femur. All right. Okay, this is condyle of the femur, condyle of the tibia, and laterally this is your fibula, right? Okay, and don't forget your patella sitting over here, right? And again, uh, since this is the anterior view, class, the anterior view, right? But I think you can imagine, class, from the lesser trochanter, one line extend downward, which is this line you call as a pectineal line, and then towards the shaft of the femur posteriorly you call as a, yes, class, this is your linea aspera, right? Your linea aspera, and don't forget this is your medial condyle, and this is your lateral condyle. Above you have one projection over here, class, and this projection we call as a adductor tubercle. Okay, adductor tubercle. The first muscle that you should know is coming from where? Superior of pubis over here, right? And this muscle straight away go to your pectineal line, attach into your pectineal line, clearly, class, posteriorly. Number two, you have adductor longus, attach dekat which region, class? It attach into your, yes, class, it attach into your middle one-third of the linea aspera, right? Middle one-third of the linea aspera. Number three, yes, you have deep muscle which is originate from where? Body of pubis, but somehow this muscle attached kat mana, class? Same thing, linea aspera. Number three, they attach pada bahagian linea aspera. Okay, number three, which is this refer to your adductor brevis, right? Attach into your linea aspera dekat bahagian mana? Proximal 1/3 linea aspera, right? Proximal, 1/3 linea aspera. And the fourth muscle will be the most medial adalah attached kat mana? Inferior ramus of pubis, right? Below, right? Inferior of pubis. And this muscle attached kat bahagian mana kelas? Attached pada bahagian inferior surface medial condyle of the tibia, and this muscle known as this is your gracilis. Faham saya kan kelas? This is what we call as a gracilis. Alright. The last one is class. The last one, I think I need to draw another diagram over here, class. Different diagram because now you can see this is your, yes, class, adductor magnus. Adductor magnus. Simple diagram. Alright, simple diagram. Head of femur, neck, greater trochanter, right? Lesser trochanter over here. Alright. Okay, shaft of the femur actually. Right, and this is condyle of the femur plus, and above you have this is your adductor to tubercle, right? This is adductor tubercle. All right, now, okay, listen carefully, class. Listen carefully. The first fiber that you should know is class, right? The anterior fiber of the hamstring, basically coming from where? It coming from this one, inferior ramus of pubis, inferior ramus because this is the superior ramus of pubis. This is body of pubis, and this is the inferior ramus of pubis, right? So this muscle coming from where? Inferior ramus of pubis. This fiber, one of this fiber. And it attach kat mana kelas? It attach dekat bahagian you all punya, yes kelas? Attach kat mana? Your linea aspera, posteriorly, right? Or specific, we can say distal to third linea aspera. Just coming from where? Coming from your inferior ramus of pubis and also ramus of ischium. So this fiber of hamstring, anterior fiber, or specifically this fiber, the green color, this is what we call as a pubofemoral fiber. Okay, pubofemoral fiber of the adductor magnus muscles. All right. The second fiber basically is located posterior, right? Posterior, and this muscle coming from where? This muscle basically coming from your ischial tubro. This is your ischial tuberosity, right? It coming from your ischial tuberosity, and this muscle moving downward, and attach into your, yes class, it attach into your adductor tubercle. So because this is your adductor tubercle, right? Your adductor tubercle. Okay. So this fiber of adductor magnus, right? Posterior fiber actually, right? Origin from the ischial tuberosity and attach into your adductor tubercle. So this is what we call as a yes class. Okay, the red color, this we call as a ischiocondylar fiber. Ischiocondylar fiber or ischiocondylar part. Okay, and this is class of our class. Okay, so now we can sum up everything over here now. So please listen carefully, class. When we talk about adductor magnus, right? It has two fiber, two part. The first part we call as a pubofemoral part. The second one we call as a ischio, sorry, ischiocondylar part, right? Ischiocondylar part. Pubofemoral and ischiocondylar. This pubofemoral anterior fiber. Ischiocondylar part basically posterior part, posterior fiber actually. And pubofemoral, you should remember that pubofemoral and ischio-femoral basically adductor magnus. What is the role of adductor magnus? Both of these muscles basically can produce adduction. Okay, can produce adduction. But the thing is, since this pubofemoral fiber is located more anterior, that's why this muscle also can assist in terms of hip flexion. Understood? All right, it can assist in terms of hip flexion. Whereas the ischiocondylar part posteriorly, right, Since this muscle, again, the prime mover will be adduction, but since this muscle more posterior, right, and as you know, when this muscle is located posteriorly, absolutely this muscle can assist in terms of hip extension. But this is the prime mover, which is adduction, but this is here the assistant movements only, okay, for your adductor magnus class. And also, because of before this, I explained to you that this adductor magnus, since this muscle is very big, it receives innervation, two nerve innervations, right? Please, you need to remember, class. After this, when we talk about plexus, okay, nerve supply to your muscles, to your lower limb, right? You should remember about this nerve. Pubofemoral part basically supplied by which nerve? It's supplied by your obturator nerve. Okay, it's supplied by obturator nerve, whereas the ischiocondylor part, the most posterior, because as you know, every posterior muscle akan supplied by one nerve, and that nerve will be your sciatic nerve, plus your sciatic nerve. Okay, back to this diagram, plus. So this is your pubofemoral part, and this is your this is your ischiocondylar part, class. Right? Okay, class. So far, do you have any questions of our class? Any questions of our class? Anything? Clear, class? Anything?
Yeah.
Right. Okay. Uh, still, uh, still your adductor magnus. Still your adductor magnus. Now listen carefully. Last one for your adductor group. In between your pubofemoral part and also ischiocondylar part, right? Can you see this opening? This opening. All right. Yes, here. Can you see this opening? This opening in between the pubofemoral part and also ischiocondylar part, this opening known as a adductor hiatus. Okay. This opening we call as a adductor hiatus. Adductor hiatus. And this adductor hiatus is very, very important because of this adductor hiatus, which is it become pathway from one artery, and this artery basically enter your adductor hiatus. It enter your adductor hiatus from anterior, enter your adductor hiatus, and then you can imagine this artery now become posterior to your knee joint, class, right? And it become posterior to your knee joint. Okay, this artery which is insert into your adductor hiatus known as a femoral artery. Okay, femoral artery, class. Maybe I can show you something. Okay, over here. All right, over here. Okay, okay, class. Can you see, class? Okay, over here. Oh, I think too many structures, right? Over here, sitting over here. But somehow, first you need to identify dekat mana you punya adaptive magnus. This is your adaptive magnus. See? This is adaptive magnus, right? This is adaptive magnus here. Right. See? This is adaptive magnus. So this is your ischiofemoral part. So this is your ischiocondylar part, and this is okay. Sorry, this is adaptive magnus actually. Okay, this is your ischiocondylar part, and here, this is your pubofemoral part, class. Can you see, class? This opening, this opening. Can you see this opening? Okay, this opening we call as adductor hiatus. And this adductor hiatus, if you focus, can you see this artery? enter this aortic hiatus. So this artery we call as a femoral artery class. Okay, femoral artery. Now, okay, this is very clear diagram actually over here. See, so this is a femoral artery, and also again you have femoral vein, right? Femoral artery and also femoral vein. This femoral artery basically carry blood and enter your adductor hiatus. Once enter your adductor hiatus, now this artery which is posterior to your knee joint, now we call as a popliteal artery. Now, by the way, what is the content of adductor hiatus? One of the content of adductor hiatus basically your femoral artery class, right? Femoral artery. Okay, class. I think finish regarding your adductor group class. So you have any question class so far? Clear class. So now flexor group finish, extensor group finish, adductor group finish, abductor group finish. Four groups kan dah finish class, right? I think the fifth group, which is, please remember, the fifth group will be this in your rotator group, right? Your rotator group, which is the first rotator group, which is, I think saya tak pernah explain in detail lagi because kita tahu every muscle. The fifth group, which is this is your internal rotator. Internal rotator. I think easy to remember. Internal rotator adalah group of muscles which is responsible untuk lakukan pergerakan which movement? Abductor juga. Which is any muscle which is ada capability untuk lakukan abduction, that muscle juga boleh lakukan internal rotation. Meaning that, apakah otot tersebut belas untuk hip abductor? What is the muscle which is responsible for hip abduction? Yes, class?
Gluteus medius.
All right, very good. The first one is gluteus medius. What else? Next. Again?
Gluteus minimus.
Very good. Gluteus minimus. And the last one? The last one will be your
Fasciolata.
very good. Tensor fascia lata. You need to remember, I think it's easy to remember, right? Whatever muscle which is produce abduction, that muscle also can produce internal rotation movement. Understood, class? Same muscle, meaning that origin, insertion, everything's very, very clear. Okay? Muscle responsible for hip abduction, that muscle also responsible for internal rotation movement, class, right? Okay. The last group, actually, before we finish, the last group basically we call as external rotator muscles. Okay, external rotator muscle. Okay, so again, in terms of external rotator class, the first muscle that you should know, which is responsible for external rotate of the hip, adalah absolutely your gluteus maximus. Second, we have not gracilis actually. Second, we have piriformis. Piriformis. Third, we have superior gemellus. Fourth, we have obturator internus. And also, we must have obturator externus. And then if you have superior gemellus, you must have inferior gemellus. And the last one will be your quadratus femoris. Okay, so this is external rotator muscle class. External rotator muscle. Okay, right now, I think straightforward. I show you based on this atlas. All right, Queen. All right, class. Now listen carefully, class. Okay, now first gluteus maximus, clear class? Gluteus maximus. Origin insertion, clear. All right. Now we remove, we cut this gluteus maximus. Okay, and also the ITB, iliotibial band. Okay, I repeat class. If you remove, if you're removing this gluteus maximus, clearly inside this gluteus maximus, you can see these small muscles. And this small muscle we call as a deep external rotator muscle. Deep external rotator muscle, which is this, the superficial will be your gluteus maximus. Deep, you can see your external rotator muscle, deep external rotator muscle, which is we can see this small muscle, and yet it assists in terms of hip external rotation. Okay, so I remove your gluteus medius, your ITB over here. All right, now I think easy to understand class. The first muscle that you should know is this is your piriformis. Okay, this is your piriformis. Okay, listen carefully, class. I think easy to understand by this diagram. This piriformis coming from where? It coming from the anterior surface of the sacrum. See, it originate from the anterior surface of sacrum, and somehow you can imagine, class, among all these deep external rotator muscles of the hip, this piriformis is basically the biggest one. Okay, it coming from where? It coming from the anterior surface of the sacrum and insert into which area, class? Insert into your, yes, clearly, class, greater trochanter. Clear, right, class? Or specific medial surface, greater trochanter. That's the first one, class. Right. If I remove this piriformis, the second muscle will be this muscle actually, and this muscle known as a superior gemellus. All right. That's why I arrange this. Okay, this I arrange this way. Okay, first gluteus maximus, the superficial muscle. If you remove this gluteus maximus, you can see piriformis. Below piriformis, you have superior gemellus. So this is your superior gemellus actually. Okay, this is the superior gemellus. Superior gemellus actually coming from where? It originates from the ischial spine. This is your ischial spine. Okay, still remember greater sciatic notch, and this is the ischial spine. And this muscle also insert into which area, class? Greater trochanter, medial surface, greater trochanter, same thing. All right. Okay. Next, I remove your superior gemellus. Now we go into these obturator muscles. Okay, these obturator muscle. This obturator muscle basically, all right, class. I remove this obturator muscle first. Okay. All right. Can you see this foramen, class, over here? Okay. Can you name this foramen, class? This foramen? Yes, class. This foramen known as a, this foramen we call as a,
Operator foramen.
very good, obturator foramen. And by the way, this obturator foramen, class, actually, this obturator foramen usually is not open foramen actually. This foramen basically covered by membrane. Understood, class? This is the membrane actually. This obturator foramen, basically obturator foramen covered by obturator membrane. Okay, so from the anatomical position, class, actually, so meaning that this is obturator membrane, meaning that this is the outer surface obturator membrane, and this is inner surface obturator membrane. Understood, class? Clear, class? This is the outer surface obturator membrane, and this is the inner surface obturator membrane. Because why you need to understand about this surface of the obturator membrane? Because of the outer surface for the obturator membrane, this area become origin for the obturator externus, class. Okay, obturator externus. Whereas inside, this is the inner surface of the obturator membrane, and this has become origin for the obturator internus. Okay, so back to this diagram. Okay. First, you need to dissect, you need to open this gluteus maximus first. All right. Second, you can see your piriformis, right? You need to remove ITB, right? You need to remove gluteus medius, right? So this is your superior gemellus. Can you see, class, over here? So this is the inner surface obturator membrane. So inner surface of the obturator membrane, you can see this is your obturator internus actually. Okay. So this is the obturator internus actually, right? If we move anteriorly, we need to remove all the adductor group first. All right, your psoas major, your iliacus. Okay, can you see class over here? So this is the outer surface of the obturator foramen. Am I right? The outer surface of the obturator membrane. So okay, this muscle we call as a yes class. Can you see class side by side? This is the outer surface. This is the inner surface. So this is obturator internus and this is obturator externus. Okay, clear class. This is class, right? So this is obturator externus and this is obturator internus. And both of these muscles, even though attached in different side of the obturator membrane, outer and also the inner surface, but eventually these two incisions basically coming to the same spot where these two area attach into which region class? Attach into your greater trochanter. Obturator internal and also obturator external insert into your greater trochanter. And also you can say the obturator external also can insert into your intertrochanteric crest. Intertrochanteric crest. But somehow the general attachment for the two obturator muscle, both of these muscles attach into the greater trochanter class. Right. Now we remove the obturator internus. Now you can see this muscle class. Right? So this muscle basically known as a yes class. All right, I remove this obturator internus. If this is superior gemellus, okay, because this superior gemellus attached dekat mana? Ischial spine, right? Attached into the greater trochanter. This region, this muscle adalah absolutely this is your inferior gemellus. So inferior gemellus, right? We can see that generally dia attach dekat mana? Dia attach pada you all punya great attach into your ischial tuberosity. It attached into the upper margin ischial tuberosity. If superior gemellus attached into the ischial spine, the the inferior gemellus attached dekat bahagian mana? Ischial tuberosity, and both of these muscles attached dekat which region? Same thing. Attached into your medial surface greater trochanter class. Medial surface greater trochanter. Right. And the last one, the most inferior for the external rotator muscle, basically this muscle, right? It has something like quadrant in shape, and this muscle known as a quadratus femoris. It's not quadriceps, tapi quadratus femoris. This muscle coming from where? This muscle coming from your ischial tuberosity. See, it coming from the lateral surface ischial tuberosity, and this muscle attached dekat mana? In between greater trochanter and also lesser trochanter, when this muscle attached into your intertrochanteric crest. Most of the external rotator fiber, your piriformis, superior gemellus, obturator internus, obturator externus, inferior gemellus, everything insert into the greater trochanter, except quadratus femoris insert into intertrochanteric crest. Okay, intertrochanteric crest, and also this muscle originate from where? Ischial tuberosity. Right. Now, right? Now complete your 6 hip rotator muscles and also your gluteus maximus class. Your piriformis, your superior gemellus, your obturator internus and also obturator externus, right? This inferior gemellus, and the last one is quadratus femoris class. Quadratus femoris. Okay. So far, do you have any questions so far, class? Okay. I think finish everything. I think finish everything regarding the muscles of the hip joint, which is consists of 6 group of muscle class.